Before we dive into these 9 warning signs, I have a quick question for you. Have you noticed any unusual sensations in your feet lately, like tingling, coldness, or skin that just won't stay hydrated? Write your answer in the comments below. I read every single one, because your experience helps this entire community. Also, I have a small favor to ask. We are on a mission to reach 10,000 subscribers to help more people over 60 take control of their health. Right now, data shows that 97% of you are watching without being subscribed. If you find this information valuable, please hit that subscribe button right now. It's free, it takes 1 second, and it helps us keep making these honest health breakdowns for you. Now, let's look at why your feet might be trying to tell you something very important. Your feet may be trying to save your life before the rest of your body even knows there's a problem. But the real question is, are you actually listening? Most people ignore the signs in their feet for months or even years. They think it's just getting older, bad shoes, or tired legs. But these symptoms are rarely just about age. One of these small changes could be your body's early warning system for a deep-seated blood sugar problem. In this video, we are revealing 9 warning signs in your feet that could be linked to diabetes. We are ranking them from the ones that seem normal and easy to dismiss to the ones that are absolutely critical. You need to stay with me until the very end, because the last 3 signs are the ones you should never, ever ignore. Why the feet? It's simple. Your feet are the furthest part of your body from your heart. When your blood sugar stays high for too long, it starts to damage 3 things: your circulation, your nerves, and your skin's ability to heal. Because the feet are so far away, they are often the first place where these systems start to fail. For those of us over 60, these changes can happen quietly. Recognizing them early isn't about fear. It's about taking control before a small sign turns into a major health crisis. Sign number 9. Excessively dry, cracked skin. We start with something most people ignore: skin that stays dry, itchy, or cracked even after you apply lotion. Most people just blame the weather or the soap they're using. But high blood sugar can cause the body to lose fluid, and it can damage the nerves that control the moisture in your skin. After 60, these cracks aren't just a nuisance. They are open doors for infections that your body may struggle to fight off. Dry skin is one thing, but the next sign is a sensation that many people describe as creeping. Sign number 8. Constant cold feet. Do one or both of your feet feel ice cold, even when you're in a warm room? People usually dismiss this as poor circulation and just put on thicker socks. But there's a reason the circulation is poor. Prolonged high sugar can damage the lining of your arteries, making it harder for warm, oxygen-rich blood to reach your toes. If your feet are always cold, your body is telling you the delivery system is struggling. Sign number 7. Swelling in the feet and ankles. Do your socks leave deep indentations at the end of the day? Or maybe your shoes feel tight by the afternoon? It's easy to blame salt or standing too long, but diabetes can affect your kidneys and your heart's ability to move fluid, leading to swelling or edema. Swelling is uncomfortable, but the next sign is when your feet start to feel like they're literally on fire. Sign number 6. Burning feet sensation. This is a sharp, hot, or electric burning feeling that often gets much worse at night. Most people ignore it, thinking they've just been on their feet too long. But this is a classic sign of nerve damage, or neuropathy. High glucose levels irritate the nerve fibers, causing them to send fire signals to the brain for no reason. Sign number 5. Unusual color changes. Have you noticed the skin on your feet turning a deep red, purple, or even getting dark brownish patches? People often mistake this for a bruise or a tan that won't go away. In reality, this can signal stagnant blood or damaged vessels. It's a major red flag that your blood sugar is affecting your vascular health. If you value clear, honest health information made specifically for those of us over 60, please subscribe to the channel right now. Our goal is to help you stay ahead of your health with simple, practical advice. Now, let's get into the top 4. These are the signs where you absolutely must take action. Sign number 4, tingling or pins and needles. This is that persistent tingling feeling, like your foot is falling asleep, but it never quite wakes up. Most people assume they just sat the wrong way or pinched a nerve. But if this happens frequently, it's a sign that your nerves aren't getting enough blood or are being directly damaged by excess sugar in your system. Sign number 3, pain while walking. Do you feel a cramp-like pain in your calves or feet after a short walk, but it disappears the moment you sit down? This is almost always dismissed as just getting old or stiff muscles. But this is a hallmark sign of peripheral artery disease. Your muscles are screaming for oxygen that your blood vessels can't deliver because of sugar-related damage. Sign number 2, slow-healing cuts or blisters. This is a very serious one. You get a small scratch or a blister from a shoe, and it stays red and open for weeks. It's just a small cut, you might say. But high sugar prevents your white blood cells from fighting bacteria and slows down the delivery of the nutrients needed to close the wound. After 60, a small cut that won't heal is a medical emergency waiting to happen. Sign number 1, loss of feeling, the silent sign. This is the most dangerous sign because it doesn't hurt. You might not feel a pebble in your shoe, or you can't tell if the bathwater is too hot with your toes. Because there is no pain, people think nothing is wrong. But this is advanced nerve damage. It's the ultimate silent warning. If you can't feel your feet, you can't protect them from injury or infection. So, when exactly do you stop waiting and call the doctor? This is the most important part of this video. If you have a wound or even a tiny blister that hasn't shown clear signs of healing in 7 days, that is your first major red flag. If your foot or a toe changes color, turning a deep, dark blue or even black, stop waiting immediately. This could mean your tissues aren't getting the oxygen they need to stay alive. Also, watch out for a fever or chills paired with a footsore. This can be a sign that an infection is spreading into your bloodstream. Severe, stabbing pain that keeps you awake at night, or the opposite, a total loss of sensation where you can't feel a needle prick, are immediate, must-talk-to-a-professional moments. When it comes to your feet, it is always better to be told it's nothing than to wait until it's too late. First, I want you to take a deep breath and don't panic. Finding these signs early is actually a good thing. It means you can take action now. Many of these symptoms can be managed, and in some cases, nerve health can even improve if you get your blood sugar under control. Here is your simple action plan. The mirror test. Start checking the bottoms of your feet every single night. Use a hand mirror or ask a loved one to help. Look for redness, cracks, or spots you didn't see yesterday. The A1C check. If you've noticed even 1 or 2 of these signs, call your doctor and ask for a simple A1C test. It's a 5-minute blood check that gives you a 3-month average of your blood sugar. It provides a lifetime of clarity. Never go barefoot. This is a non-negotiable rule. Even inside your own house, wear supportive slippers or shoes. If you are losing sensation, you could step on a small object and create a wound without even knowing it. Protecting your feet is your new daily priority. The goal of this video isn't to scare you, it's to empower you. Your body is incredibly smart. It doesn't want to fail you. It sends these small, quiet signals so you can step in and provide the support it needs before a small problem becomes a life-changing one. Awareness is truly your best defense. Now, I want to hear from you. Have you noticed any of these 9 signs in your own feet lately? Or was there one on this list that completely surprised you? Write it in the comments below. Your story might be the exact thing someone else needs to read to realize they aren't alone. And please, if you care about someone, a friend, a spouse, or a sibling, share this video with them. It could be the wake-up call they didn't know they needed. Don't forget to subscribe so we can reach our 10,000 subscriber goal and keep bringing you these honest health breakdowns. Thank you for watching. Stay proactive and take care of your feet. I'll see you in the next video.